is about diet and lifestyle. Yeah?
Mm-hmm.
And if we don't eat right, we don't drink enough fluid, the bowel cannot function as efficiently and effective as it should. Um, our body works in unison. So when the other thing that affects us, any form of stressful disorder, it can have its effect on the bowel.
Mm-hmm.
Not getting enough sleep, not getting enough rest. Um, we live in a difficult time. COVID, with disturbance and jobs and financial earnings, all these things has its own stress, which could manifest itself as bowel symptoms.
Mm-hmm.
So the yeah, so that just to name some of the main things that can affect us on a regular basis.
You mentioned stress, doc, and um, in numerous programs I've had with many different doctors, um, stress that word stress seems to come up so often, and it seems to be responsible, or it can play a part in so many little complications in the human body. Why so?
Well, stress is a normal thing in more ways than one, and we have a stress response. But there are different types of stress. You have physical stress, you have emotional stress, you have financial stress. You know, just, I mean, there are many different forms of stress. So sometimes the word is used quite loosely,
Mm-hmm.
you know, um, just to mean anything that can affect us, in more ways than one, whether it's physical, emotional, financial, um, and it doesn't matter which one it is. If it affects us sufficiently enough, it can manifest itself, because uh, it all depends on our own coping mechanism.
Mm-hmm.
Can we see a way out? You know.
So I want us to move on now and look at some of the complications that can arise in the GI tract. And I want to start first with constipation. It's a very common thing. What are some of the causes of constipation?
Okay. As I said before, you can, that is one of the causes of constipation. Um, the not enough fiber, not enough fluid.
Mm-hmm.
Um, you have uh, physical things, because sometimes you can have narrowing of the bowel, which affects the function.
Mm-hmm.
The which called strictures or stenosis. There are other disease conditions which can lead to constipation, like tumors. For example, we have medications, um, such as certain painkillers that contains what they call opioids.
Uh-huh.
You have disease conditions like Parkinson's, and certain medication that is used for that. You have thyroid disorders, particularly under-functioning thyroid, or hypothyroidism. Um, you have different metabolites in the body which is required for the smooth functioning of the muscles, like calcium, magnesium. Um, if these are low in your blood, they can have a secondary effect, on the bowel, resulting in constipation. Um, so, I think that's to name a few.
Okay, and when we have a constipation, or when that problem arises, you did mention lack of enough fiber in the diet can cause constipation. If one is faced with that problem, um, using fiber or excess fiber or a little extra fiber in that case, will that help to alleviate that problem, or you may need some medical attention?
Well, in the first place, if you present to your doctor, and you say, "Doc, I think I'm constipated." So the first question will be, what is your regular pattern?
Mm-hmm.
So you can see you're looking for a change. And then through the consultation, a process, an examination, you're likely to have some possibilities which you will want to investigate further to confirm. You want to rule out other things, and only sort of then you can look to manipulate these things to try and correct, because you can't ask somebody to just go take some more fiber and
Mm-hmm.
then they have a physical obstruction that's causing the constipation.
Right.
So the advice you give them will depend on the information you get from them, what you find when you examine them, and the results of your investigations as appropriate.
Okay, lovely. So let's move on now to something you mentioned earlier, IBS, irritable bowel syndrome. Let's break it down a little bit, and then we can look at some of the symptoms of IBS.
Yeah. Well, you know, I usually would explain to, in layman terms, I would say that IBS means that we don't know what's causing your problem, but we have adequately investigated your bowels, okay, and we
Mm-hmm.
found nothing, right? So, you know, in sort of academic terms, there are criteria for when you label somebody as having IBS. But your typical, symptoms are, your bloating, distension, um, either passing, stool too often or not, or infrequently, you know. So it's usually very sort of vague, um, symptoms of your bowel function. Um, but the key thing is that you cannot give someone that label unless you have investigated there.
Okay. Mm-hmm.
Yeah, only then you can say, oh, well, we think this is IBS.
Right. So the patient comes to the doctor. The examination is done, and the doctor determines that it is IBS. How does the doctor treat that condition?
So it all depends on what is the significant symptoms.
Okay.
And if it's a constipation, um, you know, type IBS, then you'll consider and treating the constipation. If it is a diarrheal type, so then you get a mixture of the two. So how you treat them will depend on what is the predominant symptom. So if it is a constipation, then you look at a combination of, fiber, fluid, and with some, medication and you have different classes of medication that you may have to combine to
Mm-hmm.
get the desired results. But there is no one formula that will work for everyone. So you have to work with, and you take into consideration what the other person may have used before. So if they tell you this isn't working, then there's no point going to this. You try something different, something new.
Okay. Okay. Right. Now, there's another question that I would like to ask as it relates to someone's stool. All right. As a matter of fact, I was doing some reading not too long ago and I came across that. The caption said, what the color of your stool can tell you. Is there a different? Well, I mean, yes, there can be differences in color, but what about the different colors? Is there a particular reason for that? And based on the color, can the doctor determine that there is some GI problem or something?
Well, there's some specific colors that may point to the likely source of a problem. Um, for example, if somebody comes and they tell you, oh, their stool is very pale and color,
Mm-hmm.
then you're thinking of a possible um, obstructive jaundice picture. So the questions are going to gravitate towards that.
Mm-hmm.
And then when you examine them, you're going to look for other signs of that. If somebody tells you the stool is as black as tar, then that will suggest that there is some bleeding within the bowel high up, the stomach, the small bowel, and to a lesser extent, the very proximal colon. You know? If somebody tell you that the stool, the passing bright red, but then it's coming from lower. If they tell you, so it depends on the color, even tell you.
Mm-hmm.
Sometimes the color may just reflect what they've been eating.
Okay. Mm-hmm. Mm-hmm. All right.
Because, people who are vegans, then the stool might look greenish because they eat a lot of undigested, vegetables.
Vegetables, okay.
So
Okay, folks, we seem to have experienced a little technical problem, a little difficulty with our connection. So what we're going to do, we're going to take a short break and try to get it rectified. So don't go anywhere. We'll be back with you in just a moment.
Broadcasting from the top of Observatory Roads.
You're already ill and have no time or energy to walk every which way to access your healthcare needs. So come to Spice Isle Imaging on the Carenage for a one-spot stop for all your health service needs. See our in-house doctor and get your meds from the pharmacy right on location. Digital X-ray, MRI, CT scans, mammography, ultrasound, and laboratory services are also available. So for that moment when life makes demands on you, you can make demands on us. Visit us at Spice Isle Imaging, Carenage, St. George's.
How going on, boy?
Hey, good old things.
Hey, Daisy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex or give them a call, 440-1015 or 440-1016. Or check out their website, hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
Hills and Valley Med Care Center, located on Grenville Street, St. George's, has a highly professional team that gives excellent service in massage therapy, physiotherapy, speech therapy, medical consultation, and more. Hills and Valley Med Care Center sells a wide range of medical supplies, offers home visits for patients in Grenada and Carrier Crew, and opens Monday to Saturday, 10 a.m. through to 7 p.m. Visit or call Hills and Valley Med Care Center today, 435-6904.
apologize for that little break there. You do understand how these technical things can behave sometimes. So we're back, Dr. Thomas, and we were talking a little bit about the color of the stool. So what I want to ask now, still remain with that, the odor. Now, sometimes we know it can be very offensive. Is there any particular reason for an extremely offensive odor?
There can be and that. Don't forget that the colon get rid of waste.
Yes.
And there are bacteria there that break down this waste. So depending on what you eat and how much time it spends in the colon will depend on the amount of breakdown products and gases that are produced, and therefore what comes out is the consequence of the whole process. So and I think most people can relate this to what they have eaten. Sometimes it is part of the disease process, especially in people with inflammatory bowel disease, or even some people with diverticular disease. They can get foul smelling as one of the symptoms that you kind of look out for, because there are more bacterial colonization taking place. But it has to do with the bacteria in the colon.
Okay, all right. So we spoke a little bit about some functional GI disorders. I want to ask now about structural gastrointestinal disorders. What is it, and what's the difference between that and functional gastrointestinal disorders?
Okay. Well, the structural one has to do with the with the actual bowel itself. The bowel is a tube, and it's it's a muscular tube which has different layers, and therefore if you have any growths or any inflammation within the bowel, it will have its effect. Common things that are common, and if we start from one end and go to the other end. Now, the appendix is part of the large bowel, and it's very common. And a lot of people have been affected by appendicitis. So that's so you get inflammation, which resulted in a lot of people having an operation. You have the main part of the colon. You can get little growths called polyps, and some of them can go on to form cancers. So that's one thing. You can just have inflammation, and whether it's from a virus or a bacteria, food irritant, like food poisoning, or we have some which we're not sure of the cause, but we think it has to do with inflammatory bowel, disorders. There's another big group called diverticular disease, which can happen anyway from the right colon all the way to the left colon. And all these things has other, they have different presentation depending on the severity and depending on the amount of time that this thing may occur. So this goes all the way right down to the anus, to things like hemorrhoids. little tears called fissures, you know, and to skin tags around the anus. So as you can see, it's quite a wide and very fast. So on the presentation varies immensely.
Okay, so let us look at some of these conditions individually, and we can start with hemorrhoids, which is something that's quite common. You hear a lot of people complain about hemorrhoids, and when they sit, they have pain in the anus because of these hemorrhoids. Let's talk about the cause of hemorrhoids and how they can be treated.
Well, the hemorrhoids is very common. A very good teacher of mine, he said, one of his teachers many years ago said there are two types of people in this world: those that have hemorrhoids and liars. So what he means is that everyone has hemorrhoids, but not everyone has what they call symptomatic hemorrhoids. So not everyone is affected.
Mm-hmm.
So it's there, but you don't even know it's there because you don't have any problems. But there's a strong link between people who have symptomatic hemorrhoids and constipation. Okay, so the passage have had stools with the increase of pressure in the rectum, because hemorrhoids is it's kind of similar to what we call varicose veins. So they're really congested, our veins, or in a simplified way. It's more technical than that, but we can look at it simply as congested veins. Okay? And they may cause bleeding, and that are your only symptoms. So there's nothing that you will feel as an individual. But if they get bigger, then the individuals tend to feel them whenever they use, the toilet, because they can come out.
Okay. So, but are there different types of hemorrhoids?
It's not so much different types. We classify them in different degrees.
Okay.
Depending on the severity. Typically, they go from first degree to third degree, but in at the high level, you even consider what's called a fourth degree. So, and as you realize, as the degree goes up, the severity goes up. So from the ones that you can barely see to the ones that are very obvious because they're always out.
Okay. Mm-hmm.
And therefore, the treatment will also vary.
Right. I was actually thinking in terms of what is referred to sometimes as internal and external hemorrhoids. And I take it for what it means. External, those that you can see; internal, those that are inside that you don't see.
That is just in a very sort of layman way. So an internal hemorrhoid would be like a first or a second degree hemorrhoid.
Okay. Mm-hmm.
And an external would be like a third or fourth degree. The difference between the third and the fourth is that the third is out, but you can push it in and it will stay in. The fourth is always out.
Okay. How do you treat that then? Mm-hmm.
Well, the first degree ones you can just treat with regulating your diet, so you try and relieve the constipation, and if they have bleeding, you can treat with topical stuff, your preparation aids, your anisole, whatever hemorrhoidal cream is there in the pharmacy, because even doing nothing will work just as well. The second degree one, you can treat as the first one. Plus, you may require an additional procedure. Typically, there is something called injection, where you put something irritant, which will cause the blood vessels to close in. Or you can apply what is called a rubber band ligation. So you put a band to kind of choke it. And in the third degree, you can then do, the banding plus the minus injection, or they may require an operation. And there are lots of operations for hemorrhoids, from the traditional, cutting them out, to using staples or just tying them or using laser. There are different options. And the 4th-degree ones, again, an extension of what you can do for the 3rd-degree ones. But bandings don't tend to work for the 4th-degree ones.
Okay. Right. So let's move on now to what is referred to as anal fissures.
Yeah. Well, a fissure is a tear. So the little things, but some little people that give you a lot of trouble.
Yeah. The smallest gives the most trouble.
That's a fissure. So it's a little thing, but it gives a lot of trouble. So typically, it presents with pain and some bright red blood. But the key thing is that it's pain, and it's usually pain when they pass stool. And people will typically describe it as sitting on broken glass. That's how severe the pain is.
Oh.
And it lingers on, right? Sometimes hours even after, using the toilet. That's again the treatment. It comes, bowel habits, so lifestyle changes to try and prevent constipation or treat the constipation, and topical preparations. There are specific topical preparations that is aimed to increase the blood flow in that area to allow it to heal. And that works most of the time. If that doesn't work, then the other options are using Botox injection or an operation, in that area to release the tension of the fissure. But it's important that if somebody has a fissure, you rule out other conditions of the bowel, particularly inflammatory bowel disease, so that you aim to treat the underlying problem as opposed to just what you see in front of you.
Okay. Perianal abscesses.
Yeah. Well, an abscess is pain, and we're on air, so we can't really say what we would say in a face-to-face, but it's a real pain in the behind.
Yeah.
Some of them can resolve on their own. Some of them can rupture on their own, resolve. Others, you end up in hospital so that they are surgically drained. And the key thing is a follow-up to determine if this is a one-off or is going to continue. Because depending on the origin of the problem, whether it's to do with one of the glands on the inside part of the anus or one of the glands close to the skin, you may end up with a communication between the skin and the inner part called a fistula, and that requires further investigation and treatment. Yeah, so it may be a one-off thing. It may be something that has to be followed up and treated further.
All right. So we're moving further up the bowel now, going up further into the colon, and there is something called diverticular disease. What's that, and how do we deal with that condition?
Yeah. Right. So diverticular disease is literally, pockets in the bowel. So they're all pouches. So this is the bowel has layers, and you get potential weak spot in the layers, which is thought to link with the blood supply. So it makes pockets. So when you look at it from the inside, they look like holes, like like when rats are being through cheese. If you look at it on the outside, then you'll see like little bumps, and they are common. They tend to occur, more likely as we get older. Some people don't even know they have it because they get no symptoms at all. And some people get a lot of symptoms, which can vary from pain to flare-ups. We get inflammation, you get diverticulitis, or sometimes the diverticular, one of the pockets can rupture, forming an abscess, or it may spread all over the tummy and you get peritonitis. And unfortunately, some people present with perforation as their first symptom and needing to have an operation and end up with a bag, a stoma.
Okay.
Again, some people, all they get is just recurrent flare-ups. And when you have inflammation, you get healing. And when you get healing, you get scarring, so fibrosis. And that can cause narrowing of the bowel. So eventually, some people can get obstruction because of the narrowing, so it's called stenosis.
Okay.
So, yeah.
Now, polyps and cancer of the colon. More and more we're hearing of persons who are coming down with colon cancer and things like that. Let's talk a little bit about that. Also, the importance of screening for these conditions in the lower GI tract.
Yeah. So polyps are growths, and you have all different, different type of polyps, but they're growths, and they occur as we get older. Most of them are just part of the natural aging process, but some are linked to heredity, and those can occur earlier. So the interesting thing is that you link polyps and screening. So as we get older, and in the Black people, it is recommended that when you get to age 45, you should start thinking of screening. Okay. Now, if you have a family history, then it may start earlier. And we do have we have people in Grenada with family history or abnormal, genes that make them more likely to get polyps and cancer of the colon. But for the average, population, 45 to 50. Previously, they said with 50, but 45 is more the new recommendation. And you have different screening tools. You have the stool test, where you look for blood in the stool. It's called fecal occult blood. You can do a limited examination called a flexible sigmoidoscopy, or more complete thing called a colonoscopy. We don't have it here in Grenada, but in places that have the technology, you can do a special CT scan called a CT colonography, although that is not used widely as screening, in a general sense. And in the past, they use the barium enema, but that is less and less used because colonoscopy is becoming so, risk-free, and the rate of pickup of identifying and treating at the same time, is more acceptable. Yeah.
Right. So you did mention that the polyps they can become cancerous.
They can be.
As it relates to colon cancer, what are some of the options in treating it? Surgery, radiation. What's available?
Right. Well, how you when you talk about sort of cancer, you talk about what we call, you have colon cancer and you have rectal cancer.
Okay. Mm-hmm.
Yeah. So if we look at the colon, which is the upper part of the large bowel, how you treat it depends on the presentation. So if you identify somebody having colon cancer, the first thing is to confirm that what it is, what it looks like is what it is. So it is definitely a cancer. The second step is, has it spread? Because if somebody's cancer has already spread, then aggressive surgery would not be the first thing. Now, if that cancer causing a blockage, then you'll have to do something to relieve the blockage.
Mm-hmm.
Yeah. It also depends on the individual, the age, the other comorbidities, are they diabetic, hypertensive, they had previous heart problem, they had a stroke, what is their exact state and what you aim to gain from, what procedure. So what you do will depend on the stage. So if somebody has a colon cancer, there is no evidence that it has spread, they're otherwise fit and well, or the medical condition does not prohibit them from having a major operation, then you look at removing it.
Okay.
If somebody has a rectal cancer, now in Grenada, because we don't have all the backup services, but if somebody has a rectal cancer and it's low, then that will be further analyzed using high resolution MRI, and then there'll be a discussion in a special meeting where you look at radiotherapy followed by surgery, or radiotherapy and chemotherapy followed by surgery, and then further treatment afterwards. If it's high up in the rectum and it's very confined, then the option may be just be for surgery first. So it is sometimes straightforward, but not all the time. Okay. And if you have cancer in the anus, the treatment may just be radiotherapy and chemotherapy because of the type of cells that they tend to arise from. And surgery sometimes not needed, but it is an option, but it is not always needed.
Okay. Doc, I've heard people mention about twisted intestines. I am not sure. Could you talk a bit about that? Does that happen? And if it does, how do you deal with something like this?
To comment on that is a little difficult, because sometimes it is used very loosely, and there are times when it's used specifically. Yeah.
Okay.
Because somebody may go to the doctor and say, oh, they're having this sort of griping pain, and they might say, well, maybe that's twisted bar, right? Or people say, oh, my intestine was twisted and they did X and Y, the little massage and stuff, and it got better. But in the true sense, if you the word might be used to describe an obstruction.
Okay.
Yeah, where it twists, or either on itself, or it twists around something. Yeah, and very commonly, if you had previous operation, you get scar tissue. But even without an operation, you can get scar tissue on the inside, so the ball can twist on. It can untwist itself, so it doesn't always require an operation. You know? Can the bowel twist on itself? It can twist on itself. And there's certain parts of the bowel that are a bit more mobile. It can move, and some parts are fixed.
Okay.
The parts that are moved can twist on itself.
Okay, it is 23 minutes gone past the hour of 9 o'clock. We're going to take another commercial break and we'll be back. When we come back, we'll also open the telephone line, and if you have any questions, you will have the opportunity to call, and you can pose them to Dr. Thomas so that you can get some answers. Just bear in mind that Dr. Thomas won't be able to heal your problem on the program. You may have to visit his office to do an examination. All right, so just bear that in mind. Stay with us. We'll be back with you in just a moment.
Pharmacy offers both wholesale and retail pharmaceutical and over-the-counter products. We have the most competitive and affordable prices. We are the agents for Vit Plus multivitamin for healthy everyday lifestyle and Sonatogen powder. Hills and Valley Pharmacy supplies the best quality, name brand clinical products such as Rescue Oil, Bio Oil, Neutrogena, Aveeno, and Clarisil. We offer the most convenient opening hours. Our telephone numbers are 435-6904 or 6903. Remember, at Hills and Valley Pharmacy, your health is our business. We care.
Now open, Hills and Valley Medicare Center, your one-stop for medical supplies, massage therapy, physiotherapy, and an in-house physician. At Hills and Valley, your health is our business.
At Communal, we are adapting to meet the changing needs of our shareholders and members. Times are changing, and with the changing times comes a whole new way to do business. Our parents may have done their banking a different way. Communal's state-of-the-art online banking and international debit card allows members to do business with great ease. It's like literally having a branch in your very own hands. Need a loan? Apply online from the comfort of your own home anywhere in the world, and your request will be dealt with remotely. Want to transfer between your accounts or another shareholder? No wait time for transactions to update. Voila! Who needs receipts when you can receive them via e-statements on your mobile device and save the environment? Not a Communal member? You can join our family today by applying online. At Communal, we see you working hard to ensure that you save, invest, and grow. Communal, join us today. This will be the best financial decision you have ever made. My name is Hollis Mr. Killamap, and I endorse this message.
You're already ill and have no time or energy to walk every which way to access your healthcare needs. So come to Spice Isle Imaging on the Carenage for a one-spot stop for all your health service needs. See our in-house doctor and get your meds from the pharmacy right on location. Digital X-ray, MRI, CT scans, mammography, ultrasound, and laboratory services are also available. So for that moment when life makes demands on you, you can make demands on us. Visit us at Spice Isle Imaging, Carenage, St. George's.
No, that's not how you cross the pedestrian crossing.
Really? One day I just woke up and I saw pedestrian crosswalks on the road. No one really showed me how to use them properly.
Well, this is how it's done. You never cross before doing these things. They might save your life. First, when you get to the crosswalk, you stop. You look left, you look right. If there's a vehicle coming, you put your hand out, making eye contact with the driver. Indicate.
Welcome back, folks. It's Doctor and Call, and the time has moved on to 28 minutes gone past the hour of 9 o'clock. Just in case you just joined us, we have Dr. Daniel Thomas with us, and he's an endoscopist. Yes, I think I got it right. Doc, there's one other condition I would like us to go through briefly before we open our telephone line. Colitis. And I think that's inflammation of the colon, the bowel.
That's correct.
Right. And there are some conditions that can cause that kind of inflammation. There's infectious colitis, ulcerative colitis, Crohn's disease. That's something I would like to hear about. Ischemic colitis, radiation colitis. So if we can just briefly go through these, what they are, and what bring it about, and then we can go to a telephone after.
Okay. Right. So as you said, and from last week, I said to you, anything that says itis means inflammation.
Yes.
So it stands to reason that colitis is inflammation of the colon. And yes, there are different types depending on what caused them, and it's termed the etiology. I mentioned infectious colitis, so which means that there is some form of infection, whether it's bacteria, parasites, viruses, so once you identify the underlying pathogen, then you can see, well, if you don't find any, but when you look at infection, those are the main sort of class. Mm-hmm. You talk about ulcerative. So this will come under the broad heading of inflammatory bowel disease. Mm-hmm. So there are two types, ulcerative and Crohn's. And sometimes it's difficult to know which one it is. So it's called indeterminate colitis. There is another form which is called collagenous colitis. And those you diagnose them in the lab. So you'll do the samples, and the histopathologists are the one who go and do the analysis to tell you which type it is, depending on the picture they get. Where's the inflammation? Is it just under the lining on the inside, called mucosa? Has it gone into the muscles? Does it have, we're not going to go into the details because this is a general show. Mm-hmm. So you get, they'll give you the different types. Mm-hmm. You mentioned radiation, colitis, and it's linked to radiation exposure. So particularly people who had radiation therapy for some other reason, particularly in women who had gynecological cancer surgery and needed radiotherapy, or men who had prostate cancer and had, radiotherapy. They can get it as a early consequence or a long-term consequence, and this is it varies. So from just minor bleeding to severe bleeding requiring transfusion and so on, a quite expensive treatment.
Okay. There was the ischemic colitis. which is caused by not enough blood going into the colon. How do you treat that?
Ischemic colitis is more often self-limiting. So the bleeding is stopped. And the colon gets its blood from two different sources. So what happens is that the distribution points where they meet, there is what they call a watershed area. So if on one end is coming from the top and another coming from the bottom, where the two meet, it may not join to give that part the sufficient blood supply. So they can't bleed. And so most of these diagnoses, you will make them if this person has some form of, scope at the time of the bleeding, and you will see certain things in the mucosa which will tell you this is likely to be. And also, when you biopsy it, the histopathologist, they will see, evidence to suggest to you this is the likely cause of the bleeding. But it's more often just self-limiting. They'll bleed and they will stop. And it's more from the left side of the colon that will happen. You don't have to, happen in the other part.
Okay, and finally, before we go to the telephone, can gastrointestinal disease be prevented?
Some can be prevented because, as you can see, so things like a fissure, you can prevent that because that's related to your diet for the most part. Hemorrhoids, you can prevent it, and I would qualify it to say symptomatic hemorrhoids. If you can't prevent it per se, but you can detect it early, and by detecting it early, you potentially is preventing cancer. So you can look at cancer as being potentially preventable, and I use the word potentially. Colitis, some form of it you can say you could prevent because the inflammatory bowel disease, there is stress is a big part of it. So how you handle, stressful situation is important. And saying that because, you can see it a lot in young people, particularly like exam period or something that will change the environment. So, and we all don't respond the same way. So in some parts, there are things you can prevent, but things that of a genetic nature you can't prevent.
Right. Yes.
You can't choose your genetics. What you could prevent is the likely sequelae. If you know what you're prone to, then you do early screening so that you can detect the lesions before they progress. So in understand. So some things you can prevent, others.
All right, so Doc, I think we've basically gone through quite a number of the little complications that can arise in the GI tract. So let's go to a telephone because our line has been going, and let's see if we can get a couple of questions in. Doctor and call. Good evening.
Good evening, gentlemen.
Yes, go ahead, please, caller.
Yes. I want the doctor to explain to me what is leaky gut syndrome. The second thing, 3 points. The second one is if you have an operation where a foot of your intestines is removed from your body, is that life-threatening? And third, does using of pepper excessively, does it cause any harm or irritation to the digestive tract and the bowels? Thank you very much.
Thank you, caller. Yes. Doc?
Okay, all right. So I'll start with the last one and go forward. So I think the last question was about pepper.
Excessive pepper, yes. Can it cause complications? Mm-hmm.
Yeah. Right. Now, excess is relative, and we're all individuals. So the people who can tolerate pepper and very hot pepper without any problems, and the people who cannot.
Mm-hmm.
So I think that you will look at it from an individual basis. Is there a direct effect of pepper on your GI tract? It is. Pepper can be very irritant. Yeah. So it's an irritant stimulus. But what determines how does one handle it over the other? I don't know. Yeah. The second question was about losing about a foot of your bowel.
Yes. Mm-hmm.
Now, yeah. Now, 1 foot of the bowel, and again, in different parts. You should not miss foot of. Okay. We can live without all of our colon. I think having some bandwidth problem again.
It's actually, I'm hearing you. So it's.
You're hearing? Okay.
Yes, I'm hearing you. Okay.
Your video is frozen. Yeah. We can live without our colon. Okay. And we can lose a large portion of our small bowel and live comfortable. So 1 foot, we're not gonna miss.
Okay.
Right. The first question is about gut syndrome. Leaky gut syndrome is kind of, similar to irritable bowel syndrome in terms of the similar in terms of gas, bloat, and cramps and these things, and it is more linked to food sensitivity. Yeah. So managing that it requires a very close monitoring of the foods eaten, doing allergy tests to see what you're allergic to, ruling out things like celiac and vitamin deficiency. If somebody had previous surgery, making sure they don't have what we call a blind lobe syndrome. So it's a process of sort of elimination, but it's more to do with food sensitivity, and that's my understanding.
But another question: if you have that condition, is it life-threatening, or it can be straightened out quite easily?
Gut syndrome?
Yes, the leaky gut. Yeah, leaky gut syndrome.
No, because it's more, it makes you irritable because you're having symptoms that you can't put a finger on. So if you learn what triggers the symptoms, then you can control it and live with it.
Okay.
Yeah. Just that sometimes people doesn't want to keep away from what's bad for them, and they want a miracle.
Yes.
So they want you to give them a pill that will make all their problems go away.
Yes, indeed. All right. So we continue. Our telephone number 435-2041. Do you have any questions relating to the gastrointestinal area, the intestines, the colon, all of that? We spoke about a number of things. We spoke about appendicitis, we spoke about hemorrhoids, we spoke about colitis, we spoke about quite a number, polyps, colon cancer. So if you have any questions along those lines, you can ask. The telephone number again, 435-2041. Yeah, that's the number you can call, and of course share your question or your comment with us. Let's go to a telephone. Doctor on call, good evening.
Yes, good evening.
Go ahead, please.
Yes, just a comment. First of all, I love your program, Dr. Nicole. I watch it every
Caller, we're not hearing you. Can you speak a little louder, please?
Certainly. Is this any better?
Yes, it is.
Okay, wonderful. So I'm just saying that I love your program, Doctor on Call. I watch it every week. Second of all, after years of having digestive issues, somebody gave me the advice to take probiotics, and it changed my life dramatically. So if anybody else is listening who has problems in the lower intestines, then they may want to try that. And I understand that the probiotics, they're different ones, so you have to make sure you buy the ones that have the bacteria, I guess, the probiotic, which would promote, good bowel actions. Thank you.
Thank you very much, caller. Thanks a lot indeed. Doc? She says probiotics has helped her.
Yes, and the people with irritable bowel syndrome and inflammatory bowel syndrome, probiotics has shown to be quite effective, and it is supported and promoted. So the answer is yes.
Right. Doc, quickly, what are some of the foods that can actually help good or encourage good bowel health?
Well, I found that we need to balance that.
Okay. Mm-hmm.
We need to balance that. We need a good amount of fiber. We need, our 8 glasses of water. We need exercise. Yeah? So it's not just food alone. Because if we want to eat and then just sit down all day, a bowel wouldn't work as effective. So it's a balance, and life is about a balance.
Mm-hmm.
Yeah.
Yes, indeed. What about conditions? And we didn't speak a lot about that. Conditions that cause things like diarrhea and so.
Well, we speak about, because when we talk about colitis, diarrhea is a huge part of colitis. We talk about the irritable bowel syndrome. It can be constipation related or diarrhea related. So diarrhea is a symptom, and so the causes of diarrhea can be, food poisoning, from whatever you may ingest. It can be infectious. It can be from underlying, conditions, whether it's benign or malignant. It can be due to polyps, because polyps secretes a lot of mucus.
Mm-hmm.
Yeah? So diarrhea is a symptom, and if somebody has diarrhea which lasts for a couple of days and disappear, it's one thing. If you're having diarrhea that's persistent, then that's a different story, and then it has to be investigated. So it's a symptom, and you have to look at what other symptoms you're having. When did it start? What are the circumstances? Do you have weight loss or not? Is your appetite affected? So you have to look at the whole gamut of the history. But it's a symptom, and it's all the other conditions we speak about before. A lot of them can be related to having diarrhea as part of the presentation.
Okay. Another question as it relates to bowel movement again. In terms of the passing of feces and stuff like that, is there how often should someone use the bathroom?
In terms of a definition, in terms of a sort of guideline, yeah, the what is considered norm varies from about 3 times per day to about 10 times a week. So that is the extent of you know. Now, if your normal is 3 times a day and you then going 3 times per week, that will be abnormal for you, even though you're still within the normal range. But for you, this is abnormal because that is not your normal pattern. Yeah? The once a week isn't normal, but if somebody is going once a week, you have done everything possible and you're unable to improve that, and that person gets so accustomed to that, they say, look, this is my normal, I'm quite happy with it. Yeah? So you may, but you will just accept it first and foremost. But as a definition, 3 times a day to the week.
Okay. What if someone, well, of course, there are people who eat more than others. But if you have someone, let's say, who eats small quantities of food, let's say probably twice a day, but small quantities, probably a high vegetable diet or a balanced meal. Would it be normal for someone like that to, let's say, go maybe once every 2 days or maybe twice a week?
If somebody eats like that and it's sufficient to maintain the metabolic function, and that is their pattern and it has been so for years, then you'll have to accept that as their normal. Yeah. So that's why it's important when you're looking at bowel function, you need to have an idea what happens normally for that person, what's been going on for the last year or two, not just what happened in the last week.
I'm asking the question on the basis that someone consuming the amount of food that the body actually needs. So in other words, the body makes use of everything that they consume as food. So there is basically no waste.
Not. Well, if you have very little waste, you're going to have very little feces made, because let's just imagine you have a diet of white bread and cheese. It's not fire in that. So don't expect to have your bowels moving every other day or even twice a week. There's very little in that. Okay? Yeah. Because you cannot put out what you didn't put in.
Right.
So what comes out is a direct relationship of what went in. So, okay, and the body is not going to get rid of your carbohydrates that it needs to provide energy for the cells to function.
Okay.
So something will suffer.
All right. Let's go back to a telephone. Doctor and call, good evening. Well, seem to have lost that one. 435-2041. We have about 8 minutes remaining. We may have time to take probably 2 or 3 quick calls. Let's go back to a telephone. Doctor and call, good evening.
Good evening, Godfrey. Good evening, Doc.
Yes, go ahead, please.
Good questions, actually. Now, in the old days, we did not hear of, we heard of piles. Okay, is piles the same as what we today call
hemorrhoids?
Yes, hemorrhoids. Is it the same thing? And secondly, when one look at, anal sex, isn't that contributing or could contribute to hemorrhoids and things like that? Because we know that hemorrhoids is actually swelling of the blood, the tissues and so forth in the anal passage, actually. So one would expect that things like anal sex would aggravate it. I'll hang up and listen to you, actually. Thank you. Good night.
Thank you, caller. Doc?
Okay. Yes, piles and hemorrhoids is the same thing. So piles is a sort of layman term, hemorrhoids is yes, but piles and hemorrhoids, we're referring to the same thing. Yeah. The other question about the anal sex and hemorrhoids, I don't have anything scientific to say that people who indulge in anal sex are more likely to get hemorrhoids. Or they're more likely to get a trauma, to anus. So things like, tears or fissure would be more of a thing. And any disease that which can be sexual, you can get it also in the anus. So you can get different viral, disease of the anus. Mm-hmm. Yeah, but I don't know about hemorrhoids particularly.
Okay, 435-204. We would have time for one final call. Let's go back to a telephone. Doctor and call. Good evening.
Good evening, Doc.
Good evening. Go ahead, please.
Yes, I'd like to find out the weighing of the mass, right? If it could cause any problems, because I find if it could cause any breathing problems, because you breathe, right? You breathe in, and the same air you breathe out, you still breathing back in. So I just want to ask the doctor if that could cause any breathing problems, please. Thank you.
Thank you, caller. Doc.
Well, I think it would have been unusual if you didn't get a question that's unrelated to the topic.
Oh, definitely.
So, but I think it's very topical, and we have to get used to wearing masks when we go outdoors and when we among people who are not in our regular household. Yes, they can be difficult, to breathe, but it's for our safety. So we have to learn to live with it and cope with it, because none of us really wants to get, COVID-19. So as a consequence, we have to learn it. But yes, it's difficult. If you already have breathing difficulties, and you have to do the mask. So I would think that you would want to try and stay clear of other people as much as you can and go outdoors as necessary. But is there a quick way around it? I don't know. No.
He made the point that, and I think you should probably clear that here. The same air that you're breathing out is the same air that you're breathing in, and I've gotten that kind of comment from a number of persons before. Can you clarify that?
Yeah.
Wearing the mask. Yeah.
It is. I mean, the mask that the mass population is wearing does not make a complete seal. So you're not breathing in the same air that you're breathing out. So some of the air you're breathing out will escape. We have to learn to breathe in very deep and breathe out completely so that we actually clear the space. Okay? Now the N95 mass, which makes a tighter seal. Yes, they're more difficult because you feel like breathing in the same air. But the most of the mass here, especially the clot mass that most people are wearing, there's a lot of space for air to go in and out. So we're not breathing in the same air that we breathe out.
Okay, thank you. So we take our final call. Let's take in that one quickly. Doctor on call, good evening.
Hello, good afternoon.
Yes, go ahead, please.
Can I get a number for the doctor office, please?
Doc, she wants your number. Can you give her your number to your office?
We're in a very small place, and so I think it's very easy to get, a doctor's number. And I don't think doing an educational program is the right place to give out your number on air. So I don't know which area she lives in, but really a small place. You ask people, it's very, very easy.
All right, Doc, you do have an office in Grenville? Do you as well?
Yeah. I'm everywhere.
Right.
So but I don't know what is it. But I don't think it's something that I would want to sort of encourage, giving out your number.
Right. Yeah. I do understand.
Because this is educational. It is not advertisement in a true sense.
All right. Yes, indeed. I understand. All right. Well, it's almost 10 o'clock, and this is where we have to take it down this evening. That's all the time we have. Doc, I want to thank you so very much for, accepting our invitation. 2 weeks to share with us information on our gastrointestinal area, and also upper and lower. We thank you so very much for that. We also want to thank our listeners and our viewers for their contribution, their questions, for staying with us. And I just want you to bear in mind, Doc, that I will be calling you again. So don't think that's the last. I will be calling you very often so we can continue to, as you say, educate people and to share with them information. Of course, people do learn to, understand different signs and symptoms that they can pick up to let them know when they need to visit their doctor to deal with certain medical conditions. So thank you very much. And anything you would like to say to our listeners as we wrap up?
Well, I would like to say thank you to the public for having me and to be very receptive of the information. Most people do have a local doctor, and I think they can use their own doctor as their first sort of, put of call to discuss things. And if the doctor thinks they need to see somebody more, or then that can be discussed with their own doctor. I'm very much, available to help people, and I look forward to coming back another time and discuss another topic, because there are a lot of things to talk about.
Yes, indeed.
Maybe people can suggest what they would like to hear, and we can discuss it if it's within my capability.
Yes,
to
indeed.
Discuss such a topic.
Yeah.
So, thank you and pleasant night.
Thank you very much, Doc, and do have a great night yourself. All right. To you, our listeners, we thank you again for staying with us and for your contribution. You can join me again tomorrow evening. I'll be here from 6 o'clock. And tomorrow is Wednesday. We have our released program. Of course, Alan will be with me, and as always, we will be touching a lot of issues that, of course, affects us on a daily basis. All right. In closing, again, just to remind you, it's important to follow the protocols that are in place to help us, significantly minimize the risk of getting COVID-19. And we know what these protocols are by now. The physical distancing, 6 feet, the wearing of the mask, staying at home if we don't need to go out, and let's do all we can, to prevent ourselves, washing of the hands, and that's very, very effective, of course, with soap and running water. Very, very, very effective. If you don't have that, then of course the hand sanitizer with at least 70% alcohol will also help to clean your hands and to get rid of any virus that is present. Remember also to clean the surfaces that you are in contact with regularly, like your countertops, your tabletops, your doorknobs. You go to the washroom, your telephones, all of those things that you touch on a regular basis. It's very important to keep them clean and sanitize at all times. That way, we can significantly minimize the risk of getting COVID-19. So thank you once again. Do have yourself a good night.